Good morning and welcome to the Board of Directors meeting for Lincolnshire Partnership NHS Foundation Trust. I'm Karen Scott, I'm the Trust Secretary, and before we start our meeting proper, I just need to inform everybody that's joining us this morning that very unfortunately neither our Chair, Kevin Lockyer, or our Deputy Chair, Diane Bailey, are able to join us for this meeting. So we have put a plan in place and invited one of our other non-executive directors to chair the meeting. And in line with our standing orders, I just need to seek all other board members' approval that they're happy for Chris Wright to chair this morning's meeting. So if I could ask directors to just indicate their agreement to this in the chat facility, that would be very much appreciated, and then we can move straight on. Thank you.
Great, thank you, Karen, and welcome everybody to this meeting. And I'm glad I've got confirmation I can chair it on behalf of the board. Looking forward to this morning's discussions. If we now move into the formal business, before I get into the routine business, we have received a question from the public. A member of the public regarding some of our reports and the use of technical language in our reports, and a very genuine question about accessibility and how we ensure that we can share with the public the work that we do. I in no way want to suggest that we can't be accessible, but we also need to recognise that the work we do is complex, as we've just heard, and we're dealing with a landscape which is a difficult landscape, and all our authors of reports try to provide clarity, precision and conciseness in their writing. And if we do use technical language, we provide glossaries and on our website to try and provide some guidance towards what we are trying to get over to people. So we will continue to strive to be used as plain a language as possible within the context we operate in, and we're grateful for people's interest in what we do. So if that's okay, we'll move on to the first part of the business, which is apologies. Karen, have we got any apologies today other than Kevin and Di?
Yes, Chris, just to reconfirm, Kevin Lockyer and Di Bailey, and additionally Vijay Luthra, who's our next director placement individual. So thank you, that's all.
Thank you very much, Karen. Okay, in which case we'll move on to declarations of interest. We have a schedule in the pack. Are there any new interests to be declared, or people comfortable with what we've got? I see nothing, so we will move on to the minutes of the last board meeting, which took place on the 4th of April. Are colleagues comfortable with those minutes? If so, we'll arrange for them to be signed off. Any observations on the minutes? Okay, I think that's they've been approved. Which takes us to schedule of actions, of which we have some closed and completed, and 3 in progress. If there are any issues in relation to that, please let me know. I'm just checking through. You suddenly realise how complicated this is when you have to read the chat and talk at the same time, multitasking. In which case we'll move on to chair's remarks. Well, as I wasn't anticipating doing this until yesterday afternoon, I took advantage of my newfound prominence to think what remarks I would make, and I just would like to thank everybody involved in the creation of the new LPFT strategy, which was published this week. I think it's an excellent document. It sets out a really exciting and challenging agenda for us, and I would recommend people to go and read it and see it and look at it and hold us to account for delivering it. So those are my only comments, which allows us to move on to the first substantive item, which is the Chief Executive's report. Sarah.
Thank you very much, Chris. Good morning, everybody. I'm Sarah Connery, Chief Executive here at the Trust, and here is my usual board report, providing a high-level overview of key national, regional and local issues structured around, as Chris has just mentioned, our key strategic pillars from our new Trust strategy. So in terms of healthy population, a few important national reports and government responses to just bring your attention to around the draft mental health bill, as well as an update on the rapid review into data on mental health inpatient settings, as well as there's an annual report from the CQC around monitoring of the Mental Health Act. So the 22-23 report has now been released, and there's a number of threads through that around safe staffing, inequalities, as well as reducing restrictive practices, which in terms of a read across, is what we're picking up through our adult inpatient quality programme, which we've talked about previously at the board as well. So happy to pick up any questions around that. No key timeline around the Mental Health Act bill. In terms of the government response, it very much says when parliamentary capacity allows. So can't provide a timeline on that, but we've, as a trust, I'm sure very anxious to see revisions to that act come into force. In terms of best use of resources, we've had the birth of some new services and the birthday of some existing services. So our 111 service went live this week. So early days yet, but again, much welcomed by the system in terms of the extension to those 111 services available to people. And I was really pleased to take part in the Research and Innovation Hub launch on the 17th of April, where we talked about our ambitions as a system to move forward with research and innovation around rural and coastal, including mental health and wellbeing support as well. We're working together as a system around a integrated care system infrastructure strategy, and this ties into our conversation at last month's board around our green ambitions and the capital requirements to make that a reality. So we've got a draft submission in May, then a final one in July. So we'll make sure that as much as we possibly can, it's quite a tight turnaround, that we bake that through our governance structure as well, to make sure that we're getting as much input to the final document as possible. So it'll be interesting to see, with quite a lot of aged estate around Lincolnshire, what that need summarised looks like across secondary and primary care. So this is a whole system approach, but if we don't know what the needs are, then we can't prioritise them and take them forward as a system. So that's a key piece of work for us. In terms of quality, we have had our community mental health survey results, something that we've reflected on as an executive team. Our staff survey results are very much sort of top in class in a lot of areas. In terms of our community mental health survey, very much feels sort of middle of the pack. So doing some deep dives in that feedback that we've had on the survey, and that will be coming through our quality committee in the fullness of time. So the last thing I just want to say, just to highlight as well, the Celebrating Success. We have been shortlisted for some award categories in Design and Mental Health Awards. As you know, we won one of those awards last year, so really excited about that. And I just want to say, in terms of our workforce statistics, the Integrated Performance Report shows how real sustained improvement in a lot of recruitment turnover, working to reduce our vacancies, but we do have some real pockets of stretched capacity, particularly in our medical workforce as well. So I just wanted to say a big personal thank you to everyone who's going above and beyond every day to make sure that services keep going. So just wanted to end with that thought. Thank you, Chair.
Thanks very much, Sarah. As ever, a comprehensive report which sets out a very full and wide-ranging agenda and the role that we're playing within the system, as well as the delivery of our own services. So thank you very much for that. I'll just open it up to any questions. If there aren't any, I've got one really. If that's okay, Sarah, if you could just expand a little bit on who the survey, who the participants are of the Community Mental Health Survey.
Yeah, okay, so it is a revised version this year, so it is quite difficult to compare ourselves with ourselves last year. So we're very much looking at benchmarks in terms of other providers and where they are. So for example, this is the first year where we've had questionnaires going to young people, 16-year-olds upwards. It's always been adults and older age adults as well, but now it's a much broader age range. That given, the questionnaires have also gone out digitally as well as in paper format. And I think Sharon might be able to correct me, but I think 20 of the questions are either new or changed significantly this year. So it is quite difficult to get that benchmark, but I think it's just over 200 respondents. And what the CQC do is they select a period of time where people have received services during that period of time. And then there's a sample taken of the people who received services from LPFT during that period of time. So it is a bit of a snapshot rather than anything that we've got significant data on, but it is feedback and we need to make sure that we're listening and triangulating every piece of feedback that we have from our service users and carers. So does that help? But there'll be more information coming through the quality committee.
Yeah, no, that's great, Sarah. Thank you very much. As you say, I think every bit of feedback we get, the triangulation of that will help us be better at what we do. So thank you very much for it. Yeah, Sarah, Sharon is confirming that that's a good explanation of the Community Mental Health Survey. Okay, well, look, if no further questions on Sarah's report, it's there, it's available for people to see. It sets out a very full agenda and a very busy time for Sarah and the team. Thank you.
Thank you, Chair.
So we'll move on to the next item, which is the Board Assurance Framework and Organisational Risk Register, to which Karen Scott is going to present. Karen.
Thank you, Chair. I'm Karen Scott, Trust Secretary, and I'm pleased to present this iteration of the Board's Assurance Framework. I will take the paper as read. I hope that it's quite self-explanatory and there's sufficient detail provided in the cover report. Each of the sections of the BAF have been considered by their respective board committees, and it has then gone on to the audit committee for overall scrutiny prior to being presented today. Just one thing I do want to highlight for complete transparency is that board members will note that in BAF Risks 1 and 2, there are a number of areas of text that are highlighted in red, and that is because they have inadvertently been missed out of the iteration that went to the audit committee. So we've added them in, but I want to be completely clear that they weren't considered by audit committee. So if the board can bear those in mind, please, when it considers what level of assurance it can take and whether it's happy to sign this version of the BAF off. Happy to take any questions or comments, Chris. Thank you.
Karen, thank you very much. Well, we've got Ian, who chairs the audit committee with us, and he may mention the BAF in his report later. Are there any specific questions, or are people comfortable with Karen's explanation around the items which have been added to the current presentation? This has been work in progress for some time. It's gone through the various committees. I think we're quite familiar with it, but like any document, it's only as good as its use. Ian, if you'd like to comment.
Yeah, thanks, Chair. Ian Orrell, Chair of the Audit Committee. I hope you can hear me okay, because I'm having difficulty with my connection this morning, so I catch sort of 3 of every 5 words that people are saying, so it's a bit tricky, but I think I caught what was being said there. Yeah, I think in terms of this sort of slight mismatch between the Audit Committee and the board, you know, I've sort of read the papers as an audit chair when I'm also reading them as a board member. I think the key thing to point out is this is always sort of part of a process. And the Quality Committee will clearly be, you know, front of house in terms of this, and we've got regular contact between the Audit Committee and the Quality Committee. So, you know, I'm relaxed, you know, in terms of the process issue. Clearly, as a general point, we want to get our risks down as low as possible whenever we can. So I just want to add that as an overriding comment. Thank you.
Thank you very much, Ian. Sarah.
Yeah, thank you, Chair, and you know, thank you to Karen for all the work that's gone into this. And as you said, Chris, it's iterative, but it's improving, isn't it, in a continuous quality improvement style approach. And it was just something that I think we maybe need to think about is around the medical workforce and current position, and whether that's strong enough coming through. There is a lot around sort of qualified nursing, but it was just a point for us to consider in line with the risk register going forward. Thank you.
Thanks, Sarah. I think that's a very good point, given the current context. Karen.
Thank you, and that's a really excellent point, Sarah. I just want to highlight for those that may be observing the meeting that this is actually an iteration at a point in time, and retrospectively reflecting on Q4. Obviously, we will be and are regularly reviewing our risk register, and medical workforce is obviously high up on the agenda, and that will be reflected in the next iteration that comes to board, unless things have improved significantly. But just want to highlight this is retrospective. Thank you.
Thank you very much, Karen. Okay, this is for decision. So if there are no further questions or comments, can colleagues confirm that they're happy to sign off on the current iteration of the BAF, the Board Assurance Framework? Excellent. That looks like we've got agreement. So thank you very much for that, Karen. Which case we can move on to item 3.1, which is inpatient staffing establishment, and this is Sharon Harvey. Sharon.
Thank you, Chair. So I'm Sharon Harvey, Director of Nursing and Quality. And this paper I'll take as read, but just pull out the key points if that's okay. So this is our inpatient staffing establishment update. It's my responsibility as the Director of Nursing and Quality to ensure that we undertake an establishment review of all of our inpatient services twice a year. So this is the paper that demonstrates the assurance that that's been undertaken to the board. So the review has taken place in line with NHS England and Improvements Workforce Safeguard Guidance. You'll see on page 2 the demonstration of how we are compliant at each level of the criteria. A couple of bits I want to just draw people's attention to is that at the last Safe Staffing Establishment review, we talked as a board about our commitment to ensuring that our inpatient facilities were in line with the national standards and guidance from NHS England around inpatient care, and that there was a real focus on therapeutic activity and therapeutic engagement as part of our quality service offer. There's a business case and comprehensive recommendation that's currently going through business case review process. However, in the interim, we have agreed as an organisation to ensure that there is a ring-fence budget for each of our activities coordinators on each of our inpatient wards. So that's a £500 a year budget, solely to pay for activities, and sat with our activities coordinator. And I want to give personal thanks and credit to our Director of Finance for that, because he's really championed that, although we have a really difficult financial situation across the whole of the NHS, that ensuring there are meaningful activities for our patients is a priority. And I think it demonstrates to the board that joined up approach around how we ensure quality care for our patients. So thank you, Mark. In terms of the actual establishment review, we're not recommending any changes to the establishment as part of this review, but want to provide assurance that the process has been followed. And as the paper alludes to, we're still working through ensuring that we're recruiting to establishment on our wards. But happy to take any comments or questions if there are any.
Sharon, thank you very much for a very clear report. Girish, you have a question.
Yeah, Dr. Girish Kunigiri, the medical director. Thank you, Chair. Thank you, Sharon. It's very clear and it is obviously reassuring. I think one of the things I wanted to check, what I hear on the wards is the complexity of the patients we have. So with regard to the compliance, with regard to safe staffing, does this take into equation, some of the acuity of the patients we have? Of course, we had some of the patients whom we felt are more appropriate to more specialized and out of area specialist beds, but because of various reasons, they are still on our beds. So, I can see that with regard to the staff ratios, with regard to the banding, and also with regard to the training, this says that we are compliant, but is it in line with the complexity of the patients, and does this framework take that into account? Thank you.
Thank you, Girish. It's a really good question, and in short, yes, but in reality, it's very difficult. So in short, yes, because clinical judgment is part of, and you'll see on the front, it's part of that triangle, and that clinical judgment isn't just from our safe staffing and head of nursing lead, Kerry. It's as a multidisciplinary approach. So all of our professional leads, the triumvirate in our operational directorate, so our clinical directors, quality and improvement and assurance leads, and our associate director of operations are all part of, or invited to be part of, that conversation. So having that clinical judgment and weighing up what the tool's indicating and what our professional judgment tells us is absolutely key. But what we know in addition is some of our patients who are either admitted to our wards aren't either necessarily in line with the key specification of the ward, or sometimes it's not that individual complexity, it's when we look at all the different needs of the patients together, which is where that clinical judgment is so important. So in short, yes, but there is more work for us to do, which we're already progressing through the other pieces of work around our models of care and offer and what that looks like. And also this is around the establishment of running the ward. So there's also around the skills mix for us around things like the activities coordinators, our allied health professionals, which is where that wider business case has gone through as well. Does that answer your question, Girish?
Thank you, Sharon.
Thank you.
Thank you, Girish. Thank you, Sharon. So Sharon, it's obviously, as Girish said, it's reassuring to know that we're compliant with the national guidance. But I think the most important thing is what you've just set out. It's what interventions and activity takes place on the wards, and how we ensure that we equip our staff with the skill and the capability and the resources to deliver the most effective interventions. And I know that that's something that strongly motivates you, and we'll keep our very clear focus on that going forward. So thank you very much for this paper. If there are no further questions on this, we will move on to item 5.1, which is the highlights and exceptions report from the Performance Committee meeting held on the 16th of April. And ordinarily, Di Bailey would present this. But as you are aware, Di is unfortunately not able to be with us today, and so it falls upon me to report back on this. Look, simply to say that this was the Performance Committee is a new committee within our formal governance. We've created it so that we can pull together in a more integrated way an oversight of performance across the trust, and so it's early days, we recognise that we're still building the information flow into the committee so that we can have the visibility of the issues that we need to have visibility of. I think it's important to note that that we are clearly we receive data around a number of NHS set performance priorities, and some of those targets of themselves are they can be seen as a bit of a blunt instrument, because something like perinatal service targets are all well and good, but they need to take into account the fact that there is a falling birth rate in Lincolnshire. So we need to recognise our performance in relation to the environment and the context we're operating in. But we're more than NHS targets. We are a trust which is delivering a wide range of services, and we're building a performance framework which will give us really good insight into our broader performance, and indeed our new strategy will be driving the way we do that. And we're hoping that by June we will have a new integrated performance report format which will take into account some of these additional issues. So I think that's all I want to say on that at this moment in time, unless there are any specific questions in relation to the Performance Committee. I hope I've done Di justice there. Are there any questions? If not, we will now provide illumination in relation to our performance by moving to the integrated performance report, and Mark Platts.
Brilliant, thanks very much, Chair. So good morning, everyone. I'm Mark Platts. I'm the Director of Finance, Digital and State, and I'm here today to present, as Chris has mentioned, the IPR that has been reviewed by the Performance Committee. And this is based on month 11 data. So this is data from not the full end of the year, but as near as we can get to it for this meeting. So in terms of operational updates, Chris has mentioned the performance against targets, which is an important thing that we acknowledge. However, we do need to also acknowledge that the actual increases in service delivery and how many patients we're supporting across our services has sustained a good, healthy rate of growth over the last 12 months, really. So the report picks up on a couple of key highlights, in particular, young people waiting less than 4 weeks for a children and young people eating disorders service. That's actually improved 20% from 12 months ago to over 95%, sorry, of those children and young people waiting less than 4 weeks. So there are really good elements of service improvement across some areas. Talking therapies, another area that, whilst we're not necessarily meeting the national targets, activity is increasing. We are seeing more and more people. And actually, something that's close to my heart, we're being innovative in how we're doing that. So we are using digital means to help support where we can and bring sort of more people through the services we can. In Q4 alone, we've been able to see over 500 more patients as a result of using a digital support service that ordinarily would have been waiting longer for a service. So it's important to get the best use of resources that we have to our hands on that one. From a quality update, I think an important note that is noted in the paper is, you know, the clear link between safety incidents, self-injurious behaviour, and the use of restraint. This is an area that we've got to really work on as an organisation and continue to strive and ever evolve and develop. Yeah, as we're creating safer environments for patients to be in, we do start to restrict the opportunities for self-harm and incidents, which is a really positive thing, but that can result in some areas increasing that we wouldn't ordinarily have seen, such as the report highlights the use of headbanging as an area that is a national focus, and it's an important one that we kind of work on as an organisation as well. So there's a lot of work ongoing around the CTHINK Act framework that's kind of bringing all of that learning to life and really helping us to manage the reduction of incidents and improve quality on our estates. In terms of the people section, I've done a really short summary, but it summarises such a significant amount of work that the people team have put in to support our operations this year. So my summary is vacancies have dropped for the 10th month, and we've got less people leaving. There is a significant amount of work that goes into getting to that position, but yeah, as we've gone through this year, we've really seen a stabilisation of services with more and more people coming into LPFT, and more importantly, wanting to stay. So I think that the people strategic delivery plans that are in place are only going to improve that. So that gives us real good foundation for moving forward. In terms of the financial position, so like I say, this isn't the formal year-end one. That will be coming to board in future months as we go through signing off from an audit perspective. But we are meeting our financial targets, and we have actually exceeded those. We have had a number of areas of income and some sustained vacancies across the services this year as well. So we are reporting a higher than planned surplus that we had there. However, a slight area of focus has to remain on the use of temporary staffing. So from an agency and a medical agency viewpoint in particular, there is a high demand across services at the minute. We really need to help support our medical professions to keep that stabilised service running and not increase pressure on that. So use of agency is important, and it can be a positive thing, but I think there's an area to support the teams around that one. And in terms of our capital development, I was just going to end on that one. So we are looking to meet and exceed our plan. That isn't a bad thing. It's all based on the fact that we've continued to work on our new inpatient unit on the Norton Leigh site in Boston. So a positive financial position and a good result from an integrated performance report for this month. But like I say, I'm not going into a lot of detail about the metrics because we have scrutinised and challenged that through the performance committee. So happy to take any questions from public or board, Chris. So thank you very much.
Mark, thank you very much for your comprehensive covering of all the bases. Are there any specific questions for Mark? I think one, Ian Orrell.
Yeah, thanks. Ian Orrell, Audit Chair. Thanks for the presentation, Mark. That was really helpful. It would have been far better for me if I could have heard every word you said, but anyway, I think I got the gist of it. Mark, what I just wanted to ask was, in the report there's a reference to an area of concern around out of area placements, and I don't know if it's you or Chris, but I just wondered if you could say a little bit more about that, because there is a reference to PICU being part of the issue, but there's also a reference to it being a wider national position. I just want to try and understand that a bit more if I could.
Yeah, definitely. And I've seen Chris pop up as well. So if I just pick up on the local side of it, so one of the areas of challenge that we did have around that was the water safety of the unit following a period of closure, and unfortunately Legionella was kind of within the unit. I would like to formally thank the estates team for being innovative and looking at every opportunity we have to kind of flush that out and solve that problem. We're now getting interim results that are positive, which allows us to start to consider repatriation and reopening of that unit. So locally, that's a challenge that we've had over the last couple of months, but we're looking positive moving forward. But I'll let Chris pick up on the wider national picture.
Yeah, thank you both. And yeah, really good question, Ian. And so Chris Higgins, Director of Operations. Just to say that there's there's two elements to out of area placements in that we're focusing on. One is acute mental health and one is PQ, and it's and the definition around what's appropriate and inappropriate is set nationally. So it is appropriate for some people to go out of area for specialist play and specialist treatments, and sometimes there's a safeguarding issue, or a member of staff, for example, we wouldn't put them in the ward where the colleagues are, so we would send them out of area. So it's that inappropriate use of out of area, and basically if you're commissioned to provide a service in an area, you're expected to be able to manage all of the people that need that care. So at the moment, female PQ is not something we're commissioned to provide in Lincolnshire, and therefore it's appropriate under the definition to be out of area. So at the moment, for what this target relates to is male PQ, because we're commissioned to provide that, and male and female acute. The male PQ, Mark's just explained, is once we reopen our unit, I'm confident that will eradicate the need to send people out of area inappropriate for male PQ. What the issue with the acute pathway is that we can maintain 0 inappropriate out of area places for acute. It's occasionally we get high peaks in demand for females, and when those high peaks in demand come, it tips us into having to use and outsource into other areas. It is a national problem. We are one of the better trusts in terms of this level of this performance indicator, but it's not where we need it to be. So just as a kind of some assurance to the board, and I'll bring some full assurance through in due course, is we've just launched a female pathway task and finish group that will feed into the wider quality improvement work around inpatient services to look at how we might use our services slightly differently, remodel the pathways so that we can create a bit of capacity in the wards. Our issue is that they're running hot, so they're running at 95, 100%, sometimes more than 100% occupancy, as we've admitted into leave beds and things to try to keep people local. That means as soon as you get a peak in demand, we're out of area. Well, we really should be operating at 85% occupancy so that we've got a bit of capacity to absorb those peaks. So work is ongoing. It is an area we need to focus on, and just to say that it is a national mandate. The date's been reset, but by the 1st of April 2025, all organisations, all systems are supposed to have 0 inappropriate out of area placements, and that's a target that we're committed to achieving. Thanks, Chris.
Thank you, Mark. Thank you, Chris. And Chris, I'm sorry, I might have just missed you saying this. When are we anticipating PQ will reopen?
I'll let Mark answer that one.
So we're just waiting final water results, Chris. So we're hoping certainly in the next sort of 8 weeks, some time frame right within that. So we will start to get patients in as soon as we can.
Okay.
Yeah, and I think just to add on to that is that there's a synchronised process between the opening of the unit so that we can get it released from an estates perspective and the operational team being ready to go live, and so the estates and operational teams are working really kind of hand in hand on this one to make sure that we're ready to go as soon as the unit is safe to do so.
Great, thank you very much. Okay, so if there are no further questions, I've got 3 observations. Firstly, the point around data flows, and so we're not how we're working with our partners to ensure we can capture the necessary data, which gives us a better picture of our overall performance. I think it's really important, and I note the collaboration between us and LCC in relation to children and young people. The second point I want to make, and I think it's really important that we celebrate the progress that's been made in our people division, and some of those people metrics are really impressive, and not just from the recruitment point of view, but from stabilising the turnover of the organisation. So a big shout out to colleagues in people. And in relation to finance, sometimes in this environment where we're constantly under financial pressure, it's easy to kind of ignore the fact that this trust is managed effectively from a financial point of view. And so, Mark, thank you very much for that. And and it was a bit of a throwaway, but the progress that we're making in the eradication of dormitory schemes at Norton Lee is a really important development for the trust and indeed for Lincolnshire. So thank you very much for that, and thank you team for the IPR. So if there are no further questions on the IPR, we will move to the next item, which is the Emergency Preparedness, Resilience and Response Annual Position Statement. Over to you, Mr. Higgins.
Thank you very much, Chair. So the purpose of this report is to, as part of the annual assurance process and compliance process with the National Emergency Planning Core Standards, we're required to bring a report to board to just set out our position statement and our level of compliance. Just for information, as mentioned in the report, the work has been led through our Health and Safety Committee, where our EPRR function sits, and it's been reported to the Sustainability Committee in terms of our level of compliance following the recent assessment, what activities we've done over the last year, and what activities we've got planned to put us back on track, which you'll see in the report in terms of our level of compliance. So the 4 elements that we need to report on as part of this process, which is training and exercising, incidents experienced, lessons learned, and compliance with the annual assurance process. I won't go into the detail. You can see there the list of activities that have been happening over the last year. The important point to note is that following our self-assessment and then our challenge and confirm with NHS England, we've come out as a result of non-compliant with our self-assessment around our EPRR core standard self-assessment process. That's because out of the 58 core standards, we were partially compliant on half of them, 26 of them, which automatically gives us a rating of non-compliance. Now, for context in that, whilst that's really obviously very disappointing for us and for the teams involved, for context, is the standard of evidence that's required to meet the same standards has increased year on year, as we've seen national events and incidents such as Manchester Arena and the Grenfell incidents. It's called for greater evidence and greater resilience in the NHS, and that's reflected in the level of evidence that's required to demonstrate compliance. So our evidence submitted the previous year didn't stand up to the same level of scrutiny this year. So we've just got to keep evolving. We've got to keep progressing with our compliance levels. You'll see in there on the top of page 4, we're not alone in this position. While some organisations in the region have managed to get substantial compliance, I don't think anybody's got the full compliance, and there's a range of outcomes in between. On the back of this result, we have developed an action plan that's been approved by Sustainability Committee, and that will be tracked through both the Health and Safety Committee at an operational level and through Sustainability Committee at relevant times, and we'll be preparing for our reassessment in the autumn time. There are 2 risks that I just wanted to flag on this. There is a risk around training courses. So we've got quite a large pool of people on our tactical manager training pool. That's making it difficult to get everybody compliant. So we're reviewing that on-call manager process to be able to rationalise the number of people on that and make it a much more manageable group in terms of training compliance. And the other bit is capacity. We have an emergency planning officer who has a lot to do. It's a growing organisation and lots more evidence to collect. And so I'm working with colleagues in our estates and facilities team where the post is hosted to see if we can put some extra capacity around that person to get us just some extra resource to reach all parts of the organisation, and hopeful that we'll get some capacity over the next few months. So our position, as I say, at this stage is non-compliant, but with a robust action plan that's been approved through Sustainability Committee to get us back on track.
Thank you very much, Chris. Look, this is there's a lot of work involved in this, and as you say, although we're disappointed that we're non-compliant, we're as usual grabbing it by the horns, and we have an action plan, as you say, and we will monitor this through the committee I chair, and we have every confidence we'll achieve compliance in due course. So thank you. Are there any other questions for Chris in relation to the emergency annual position statement? Girish.
Yeah, thank you, Chris. That's really helpful. I'm Dr. Girish Kunigiri, the Medical Director in LPFT. Chris, I know that there will be a lot of information behind this, but for the purpose of the board, when we say that we are non-compliant, is it helpful to know how far we are non-compliant with? Like, for example, the different pillars or the strands you have mentioned in terms of the training, the exercise, and so on, how far we are from those, so that it will help us in terms of, how much we will have to do in terms of mitigating that gap. And the second thing is, I did see that one of the Lincolnshire organisation is fully compliant. So is there anything, you know, we need to learn from, you know, our partner organisation for us to become better? Thank you.
So there's two questions in turn. The detail of the action plan is being monitored through the Health and Safety Committee. There's 58 core standards. So whilst there's a requirement for this particular process to report on those 4 elements of training and instance and etc., the compliance itself is a compliance against 58 core standards running across a whole range of different things, from policy, procedure. This process here is part of one of the core standards about whether we've done an annual update to board. Each of those, just to be clear, is that there were too many partial compliances. So we weren't rated non-compliant on any individual measure, but we did get partial compliance on too many, which overall made us non-compliant. So good distinction to make, but that details in the action plan. I'm happy to share it with colleagues if they feel that'd be helpful afterwards. In terms of the learning in the system, great point. Up until now, I think organisations have operated in isolation. The ICB, Integrated Commissioning Board, are the organisation's got the full compliance or substantial compliance. We're working with them really closely, using expertise from the ICB to help work alongside our emergency planning team. So, and we are looking more carefully about how we can bring that learning together, shared policies, protocols for how we're going to respond as a system rather than individual organisations. So much more work to do in that space, and an absolutely great point to make. We're stepping into things that where we can share resource, share learning, do things once for the system, then let's do that, whilst obviously there'll be some things that are particular to LPFT.
Thank you, Girish, and thank you, Chris. Okay, if there are no further questions in relation to that, we'll move on to the highlight of this meeting, which is the highlights and exception report from an audit committee. Ian.
Yeah, thank you, Chair. In terms of the report itself, I'll take it as read. So I think it's fair to say I haven't got too much more to add to it, but there are one or two sort of key messages that I'd just like to get across from that latest piece of work. First of all, just to say we undertook the annual review of governance arrangements. I won't say any more on that because I know that's the next item on the agenda. So the audit committee have already had a go at that. Other things to mention is, as usual this time of year, we look at the annual governance statement, and we saw the draft annual governance statement laying out all the issues around our governance throughout the last financial year. The one thing I would highlight in there, there's a reference in there to the Head of Internal Audit's interim opinion on the position of our internal controls, and the opinion they gave was that we have a reasonable assurance level in relation to those internal control systems. Reasonable is in some respects quite a strange way of describing something. It can look I think a little bit underplayed to some people. To help, it's the second highest assessment that you can receive, and I think it's probably the position we expected them to reflect on for us. We know that we have got checks and balances across the system, as you'd expect. But at the same time, there are things that we know we can do better, and I think we'll look to do that this financial year. The other thing that sort of supports that, we received a report from the Director of Finance to explain that it's clear that we have a going concern, i.e. a strong financial position going forward. And we were also able to hear from the external auditor that they're well positioned in terms of moving towards closing down the accounts for this year. So all of that was good to hear. So all of that was sort of a backward look, as it were. I'll probably finish just by saying, in terms of the future issues, we made a slight tweak into the audit committee's terms of reference, and that's largely to reflect the greater emphasis we want to see on strategic risk management. So that was, I think, a fair summary of what we covered off. But happy to take any comments or questions.
Thank you very much, Ian. Are there any questions? Grateful, Ian, for your explanation of the reasonable label. It's a framework which the auditors are using, and so, as you say, if you just read it as literally, it doesn't actually give the full sense of the confidence they have in our control. So thank you very much for that. If there are no further questions to Ian, that gives us the opportunity to move on to the annual review of governance arrangements, and we're back to Karen. Karen.
Thank you, Chris. Karen Scott, Trust Secretary. As Ian has just alluded to, this is a comprehensive annual review of the Trust's annual governance arrangements and is a retrospective looking for the year 2023-24. As he mentioned, it was reviewed in quite some detail by the Audit Committee at its meeting on the 18th of April. And following that scrutiny, board members will notice that within the recommendation, the Audit Committee has provided its opinion on the Trust governance arrangements for that period of time for the board to consider in reviewing that document today. So happy to take any questions or comments, but just to provide assurance that it has received quite detailed level of scrutiny previously. Thank you, Chair.
Thank you, Karen. And we're being asked to approve the this report. Yes.
Yes, that's right, Chris. Please, it does need approving. And as I say, if it could be borne in mind, if that opinion from the Audit Committee could be taken into consideration in providing that approval.
Thank you very much. I think we colleagues are in agreement. Karen, thank you for all the work that goes into governance, and there's a lot of activity, there's a lot of administration required to make it run smoothly, and we're very grateful for that. So thank you. If there are no specific questions, we will move on to the next item, which again, Karen, is you. This is the Karen Scott Show, forthcoming board programme.
Thanks, Chris. This really is just for board members to note, and it's hopefully a helpful document in directors managing their diaries moving forward. So a list of forthcoming meetings, nothing else to highlight specifically. Thank you.
Thanks. And Karen, just this is a public document, so our audience are aware of all the various meetings that take place.
That's correct. Yes, this paper is included in the pack of papers that's been published on the website for today's meeting. So any member of the public can see these dates.
That's great. Thank you very much. OK, so back to Mark Platt and budget setting policy.
Very much, Chair. So good morning again. Mark Platt, Director of Finance, Digital and Estates. I'm presenting today the revised budget setting policy for this financial year, so 24-25. So again, as previous policies, this one has been kind of reviewed and scrutinised by the Sustainability Committee, and changes made on the back of those discussions. So the budget setting policy is a really important document, because for us to maintain as a sustainable organisation and get the best use of our resources that we do have, it's important that we maintain our budget position as an NHS organisation. But budgets are live, our managers use them daily to sort of assess the costs and make purchase orders and keep our organisation running, providing the best service that we can. So it's a really important policy. No significant changes this year, other than we are innovating a little bit around our approval process. So that will hopefully streamline how we get our budgets approved when we launch them shortly for this financial year. So happy to take any questions on the comments and the report, but like I say, it's been through the Sustainability Committee and it's here for approval.
Thank you very much, Mark. Perhaps you could just let us know when the NHS planning guidance was released this year.
There've been some challenges nationally around that, so slightly later than ordinary, but we have managed to submit a plan, and the budget setting policy does reflect the changes in that guidance.
Yeah, thank you. I was being slightly facetious because we have to work with a degree of second guessing because the national guidance is often not released until quite late in the process. So huge thanks to everybody who works in that in that relative vacuum, albeit we tend to know what the guidance is likely to say, but it's still not straightforward. So thank you very much for that. Sarah Connery.
Thank you, Mark, and approval for the paper. I think we've talked about this as a executive team around possibly a different approach for 25, 26. I can't believe I'm saying that. Around potentially zero-based budgeting. The world has moved on so much, and we talk a lot about incremental changes to establishment, and the finance team and budget holders do a fab job of that control. But I'd like us, for next year to think maybe about blank sheet of paper. As a different approach to our planning going forward. So that's just something to flag as a consideration. Thank you.
Thank you, Sarah. As the chair of the Sustainability Committee, we're very interested in the work that's going on around demand and capacity, and I think some kind of notion of zero-based budgeting would be important. We're still overseeing a recurrent underlying deficit for the trust, which we need to eradicate over the next few years. So thanks very much for that, Sarah. Ian.
Thanks, Chair. Yeah, I just really wanted to echo pretty much that point that Sarah made and you've responded to. I always think it's quite good practice every now and again to get off the train and reset. The thing I'd add to it though is whether we could perhaps get that philosophy to be adopted across the system, because lots of the things we see, in terms of patient care and so on, are system-related issues. I think that don't get us into a sort of optimum output, and maybe if a zero-based budget approach across the system might work. But there we go.
Thank you, Ian. I don't know if you want to comment on that, Mark. It sounds a very sensible thing for us to be encouraging.
I think it's a really good call, and it will certainly help with the sustainability of the system financial position as well.
Thank you. Okay, so we're being asked to approve the budget setting policy. Are colleagues happy to do so? There's lots of pinging and yeses, so great, that's approved. Thank you very much, Mark. I appreciate all the work that goes into putting these things together and actually doing it. So that leaves us at a rapid I can't speak. A rapid review of where we've got to, and we're now into any other business. Are there any items of other business from colleagues? Okay. Karen, you might need to help me out. Oh, hang on. Mark, you have a comment.
Sorry, apologies, Chair. So if I could, I just wanted to take us back to the discussion around the PQ when we were sort of talking about the timeframes on that one. What wasn't very clear on is it's important that we phase that repatriation. So we will be opening sooner than the 8 weeks, but we have to bring patients in a safe, controlled manner. So it will take a period of time to be at capacity level. So I just wanted to confirm that following the discussion. Thank you.
Thank you very much, Mark. Absolutely. Ian, have you got another comment, Ian, or am I looking at an old one? No, okay, ignore that. So Karen, oh yeah, thank you, Karen. So Karen, just some advice now, because there's an item called review of meeting. Do we do that here formally or afterwards when you mark me?
So this is the board's opportunity to make any comments that it would like in public about how the meetings run, how the business is being transacted. It's not an obligation. There's no obligation to do that, but if anyone has any pressing comments or thoughts that they'd like to express, then this is the opportunity to do that, Chris.
Thank you very much, Karen. Which takes us to Sarah Whiteman.
Thank you. Yes, I thought it was a very good meeting. Thank you, Chris, Chair. Thank you for stepping in at such short notice, and I think it's been run very well. I particularly liked. I've only been a non-executive director, sorry, Sarah Whiteman, non-executive director, for a few months now, but I can already see the iterations and the improvements, particularly in the integrated performance report and its presentation. So I just wanted to comment on that and give feedback to the exec, because I thought it's very positive.
Thank you very much, Sarah, and I echo that. I think there's every meeting, I think the quality of information improves, and I think the focus on performance drives us all every day. So thank you. Okay, if there are no further comments, I will draw the meeting to its conclusion. The private board meeting follows. If you'd like to have 2 minutes break, we'll come back at 10:35. Only joking. Let's come back at 10:45 and we'll reconvene then. Thank you very much.
Thank you.